Amiodarone. Some common trade names for it is Cordarone or Pacerone, although it is very commonly available in generic form. It is a class 3 antidysrhythmic. Mechanism of action for it is it blocks the sodium, potassium, and calcium channels during cardiac contraction. It is an antidysrhythmic, so it also prolongs action potential and repolarization, tries to slow everything down, reset it all, and get rid of those weird dysrhythmias that you might be dealing with. It also decreases SA node function and AV node conduction. And all of that is designed to convert typically ventricular tachycardia back into a sinus rhythm and reset everything. Pregnancy class is D. So we want to use caution with that with pregnant females, but keep in mind, when it comes down to it, we treat the mother's life over the baby's life because without the mom, the baby won't survive either way. Lactating women should not breastfeed following use of amiodarone. Some indications for it, cardiac arrest with VTAC or VFib. Tachycardias with a heart rate greater than 150, and then you want to follow your ACLS algorithms for that. There are several different indications on that. Just follow ACLS. Contraindications, cardiogenic shock that you're dealing with, some sinus node diseases, including sick sinus, second and third degree AV blocks, unless you have a functioning pacemaker in place. Some adverse reactions we do want to watch for with it is dizziness, fatigue, tremors, ataxia, pulmonary edema, nausea, vomiting, bradycardia, hypotension, prolonged QT interval, and then Stevens-Johnson syndrome is possible as well. Which Stevens-Johnson syndrome can be a very serious, it's a skin reaction, typically brought on by a medication or possibly an infection, and causes like flu-like symptoms and some tissue necrosis on the skin and stuff. So that is a very serious thing, very serious medication reaction that is possible. Some drug interactions to watch for, beta blockers and calcium channel blockers. If a patient's already on those or if you're giving them other ones of those, they may potentiate bradycardia, sinus rest, and AV blocks and could cause further harm to the patient. And then if you're using this in conjunction with digitalis and the patient is prescribed digitalis, then it can cause digitoxicity where they just have too much of it in the system. Standard dosage, cardiac arrest, 300 milligrams IVIO, and then you follow that up usually with 150 milligrams over 10 minutes, kind of mixing that up in like a 100 ml bag or 250 milliliter bag. Tachycardia with a pulse, you give 150 milligrams over 10 minutes in an attempt to convert that. For pediatrics and cardiac arrest, 5 milligrams per kilogram IVIO, and then you may repeat it with an infusion up to a maximum of 15 milligrams per kilogram in 24 hours. So that's kind of the max dose for the kids. And of course, if a kid is so big that the 5 milligrams per kilogram equals 300 milligrams, don't go over 300 milligrams. The onset for it is 1 minute or so, peak effects within just a few minutes, and then it usually lasts in the body about either 20 to 60 minutes, somewhere in that range. Something to keep in mind, you see it sometimes on the transfers, the max adult dose in 24 hours is 2.2 grams. So if somebody's really sick and they've been given a lot of medicines, it might be something to watch for, making sure we don't overdose them on that. Here is some special considerations like we talked about, is that 2.2 gram max adult dose, and then make sure you're following ACLS protocol. So we talked about that action potential just a little bit, and this is a class 3 antidysrhythmic. So it blocks the potassium channel blocker there as the cells are trying to repolarize and slows it down so the cardiac cells aren't able to repolarize quite as quickly, and so therefore hopefully is resolving the dysrhythmia and improving that.